Good afternoon, Mr. Alan Bernard. My name is Ida. I'm a nurse practitioner student from United States University based in San Diego. I am assigned to do your thorax and lung examination today. Before we start the process, I would like to ask permission if it's okay to videotape and put it in or post it in YouTube so my professor could review the examination.
Yes, you can.
And another permission, I would like to ask if during the examination, if you could take off your shirt so there will be better visualization and accuracy of the examination.
Sure.
Thank
Okay.
you. I will be giving you also instructions during the process. So, and also if you feel pain or discomfort or you become uncomfortable, or if you have any questions during the process, please let me know. Thank you so much. And before we start, would you mind telling me or state to me your full name and date of birth?
I'm Alan Bernard. I was born March 26, 1965.
Okay, so we are going to start. If you can just take your shirt off, and to be easier to go in front and in the back, if you can just can you stand 1 second? There we go. Okay, scoot to the side a little bit and scoot back. Okay, so the first process is I have to do inspection. So I'm going to check your chest for symmetry during respiration. I'm going to check also for your respiratory flow and movement, checking for use of accessory muscles during respiration, or if there is any diaphragmatic breathing, checking for respiratory rate and rhythm. Then I'm going to check for your fingers, if there is any cyanosis or bluish discoloration or clubbing of the fingers, both in your upper extremities, the same as your lower extremities. Also, I'm checking your lips for any bluish discoloration or cyanosis, and also if there's any pallor or paleness. The same thing, I'm going to check posteriorly or at the back. I'm going to observe your chest for symmetry during respiration, checking for respiratory flow and movement, if there's any use of accessory muscles, if there's any diaphragmatic breathing, as well as check or inspect for the respiratory rate and rhythm. Also, I'm going to check for the anterior-posterior ratio. So if you can just move your arms towards the back of your head. So I'm going to measure, okay, and then, all right, 7, okay, 7. So the normal AP ratio should be 2:1. All right, so next is we are going to do palpation. So I'm going to check first for respiratory excursion. So what I'm going to do is I'm going to locate the 10th rib, and then by the midline I'm going to put my thumb pointing upward, and during respiration, if you can take a deep breath, you see that my thumb lifted and my other fingers move outwards. Okay, so that is checking for respiratory excursion, checking for symmetry. Next is I'm going to check for tactile fremitus. So while I'm gonna use the palm of my hand, just like below the small or the little finger, I'm going to palpate your chest, and when you feel my hand, you have to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so I could feel the vibration. Next is I'm going to do palpation of your chest again to check for costochondral tenderness. So you tell me when I touch your chest if there's any tenderness or pain. Is there any pain?
No, no pain.
Okay. So I'm going to do the same thing at the back. So posteriorly, again, I'm going to check for respiratory excursion. I'm going to check for the spine with my thumb upward. If you can take a deep breath. Okay, so again, you will notice that my thumb lifted and my other fingers move outward. So this is checking again for respiratory excursion. Next is you have to sing 99 again while I'm touching your back.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so that is for tactile firmitus to check for air trapping. Next is I'm going to palpate again to check for costochondral tenderness or pain. Did you feel any pain when I touched
No
you?
pain.
Okay, so that is for palpation. Next is I'm going to do percussion. So with my non-dominant hand, the third finger will be the one in contact with the skin, and with my dominant finger my dominant hand I'm going to use my third finger to do the tapping to elicit a sound. So okay, so if the tapping is still in the lung fields, you can feel you can hear resonance, and then when it is over the sternum, the ribs, or the liver, it will cause or it will elicit a dullness sound. So I'm going to do the same thing at the back. So I'm going to palpate. I'm going to do one side first because I'm going to check for diaphragmatic excursion. So when we check for diaphragmatic excursion, it is mapping the movement of the diaphragm during inspiration and expiration. So okay, so I feel, or I did hear the first dullness sound in this area. So I'm going to ask you if you can inhale and hold your breath. Okay, you can release. So I'm going to mark here. This is where I hear the first dullness sound. So the next thing I'm going to let you do is you have to inhale and exhale, and during exhalation, if you can hold it for me. Okay, so I'm going to percuss up. Hold your breath for me. Okay, so this is the first area that I could feel, I could hear resonance sound. So I'm going to measure it. So it is 4 centimeters, which is the normal, which is normal because it should be between 3 to 5 for a normal person, but it could go up to 7 for some athletes. So I'm going to do the same thing on the other side. I'm going to percuss and check for the diaphragmatic excursion. So I'm going to do percussion. Okay, and do the same process. Next is I'm going to auscultate. So I'm going to listen to your lung sounds with the use of my stethoscope. So every time you you know, feel the stethoscope on your chest, if you can do some deep breathing. Okay, thank you. So I'm going to start on the top for the anterior part of the lungs. Okay. Okay, lung sounds clear. Going to do in your back. Okay, thank you. Lungs clear posteriorly. The last thing I'm going to do is special testing. So I'm going to do check for bronchophony. So while I'm listening to your lungs, I would like you to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so with bronchophony, if it is positive, then I would be able to clearly hear the 99. But for a normal lung sounds, it should be muffled and inarticulate. I'm going to check for another special testing, which is called echophony. So every time I listen to your lung sounds, when you feel the stethoscope, if you can say E.
E, 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 E.
Okay, so um, for a positive echophony, when he says E and I hear it as A, then it becomes positive, meaning there's consolidation in the lungs or like in a pneumonia. So that concludes our chest and thorax examination. Thank you.